Let me just start by introducing you to my Health Power audience, Dr. Theodore Fields of the Hospital of Special Surgery in New York City and medical advisor of the publication Creaky Joints. I suppose that title of the publication tells us something about your specialty related to creaky joints. Is that correct?
Yes, I'm a rheumatologist and see all kinds of arthritis, although I've always had a special interest in gout.
Okay, very good. Well, now that you mentioned that, we're talking today on Gout Awareness Day, which is May 22nd.
Okay.
So that is also an important issue as we begin our discussion. I understand that there's a survey which you can discuss with us related to gout, patients with gout, and also caregivers related to gout, and relationships which are experienced by them. And the other thing would be to talk about any myths about gout and that sort of thing.
Sure.
When one mentions gout, one usually thinks, well, many people think of self-inflicted conditions related to overindulging in food and drink, but of course that is not the case. We know, you and I are certainly aware that gout is a form of arthritis, and your survey is going to tell us more about what you found related to gout and arthritis. So why don't we have you first say what gout is and what the symptoms are?
Sure. Gout is the most common type of inflammatory arthritis. It's most commonly in the lower extremity, particularly the big toe, the middle of the foot, the ankle. It can be in the knee. The big toe is the most common spot to start. And it has a pretty classical kind of presentation where it gets red and hot and very inflamed, intensely painful. People often describe it as they can't put a sheet onto the toe. It's so painful. They can't get a shoe on. They can't walk. They can't go to work. Very intensely involving their quality of life. And it's common disease. 8.3 million people in this country with gout.
Let me just ask you, did you say that gout is more common than osteoarthritis?
Oh, no. It's the most common inflammatory type arthritis. So, for example, it's about 6 times more common than rheumatoid arthritis. It's more common than psoriatic. But osteoarthritis, more mechanical, that's the most common.
Okay. So, and just one other thing, is gout more common than rheumatoid?
It's about 6 times more common than rheumatoid. So there's a lot of gout out there.
Okay. What causes gout?
Gout relates to the uric acid in your system, so you have too much, and it's on a hereditary basis. Either you make too much, or your body's not able to get rid of the uric acid well enough, so you build up the uric acid in your system, it gets deposited in the joints, and it crystallizes out. The body attacks the crystals and causes the inflammation.
And did you say is it genetic?
Yes, almost everybody with gout has it on a genetic basis.
I see. Now, tell us about the survey that was done and what the survey found.
Yeah, so Creaky Joints did this survey. I serve as an advisor to them. They looked at 1,000 patients with gout and 500 caregivers, and they had a lot of interesting findings. One of them was that the average patient in the survey had 8 attacks in the year, and 75% of those patients said that they needed help with their basic needs during the episode. So they were really impactful episodes. They really got in the way of their life. And people don't tend to tell other people about their gout. 25% of them did not tell their doctor about an episode of gout, and 1/3 of them didn't tell their partner about it. And part of that relates to either embarrassment or not feeling that anything could be done for them. And another issue was that patients often blamed themselves. Only 35% of patients in the survey appreciated the inherited aspect of gout. They really were focusing on diet. And even though diet's important, it's not the whole focus of gout. Watching your diet helps, but you really need to get that uric acid lowered. And then there was one more thing to point out was that the effect on work was really impressive in this survey, that patients on average lost 6.3 work days per year, and I was surprised by this, their caregivers lost 5 days of work per year just based on taking care of them, so that there was really a big impact of this disease.
What about age relationship to gout? Is it...
Well, for men can get a gout can start very early. Actually, it starts at 18, 20, and then goes up with time. Women tend to start getting gout around the menopause time because estrogen is protective. So women tend to be behind men, but after a while they start to catch up. So it does get more common with time as an age, but men can get it very young.
Also, what about race or ethnicity? Any relationship?
Pretty much it crosses all races and ethnicity. There's some issue with some of the islanders outside of New Zealand. Some of that may relate to overweight, and there may be some genetic factors. But in general, it crosses all races and ethnicities.
Right. It was interesting because gout, as you say, makes it almost impossible to touch the toes, or the toes especially, or the lower extremities. How is it that people can hide it from their partners or caregivers?
Wait, could you rephrase that question?
Okay, since, as you say, persons with gout very often are unable to touch the toe or the lower extremity in the area which is affected.
Yeah.
So that being the case, how can they avoid showing the partner that they have it?
I see. Yeah, I think it's a challenge. I think that sometimes they just stay in bed and say they don't feel good. They don't even say that they have the attack. Oh, you're right though. Gout's not an easy thing to hide, but that's what the survey showed, that people often don't. In fact, one of the things the survey showed as well is that the caregivers were unhappy about it, and they wished that the patients would tell them more about their episodes. So it is a real thing, but you're absolutely right. Some gout is very hard to hide.
Okay. And what about treatment?
Yep. Fortunately, we have good treatment. The survey showed that 68% of patients thought that that having attacks was just the way it ought to be. That's a fact of life. And education should teach them that that's really not the case. The gout can get better, and if they get on medicine that lowers the uric acid, 6 is the level. We want to get them below 6. And if they can do that and keep it below that by having the right level of medicine and the right medicine, they can have the gout attacks go away. Only 1 out of 10 patients in the survey actually knew that the goal was less than 6, so people really didn't know it. So it's very important that people get treated, that they get to their doctor, get checked, get the diagnosis of gout confirmed, get medication to lower it. And that's really the message for people, to acknowledge it. Don't let any of these misconceptions stand in your way. Get out there, get diagnosed, and get treated.
And what about the uric acid or urate concentration in various foods? What's more important, the medication or the foods that one is taking?
Right, they're both important, but I think in the long run, it's really the medication, because we know that people just watching their diet, it's not really enough.
I see.
Oh, and I'd recommend, if people wanted to see more about this survey, they could go to creakyjoints.org. That's the website of the organization that did this survey, which has all the details, and patients can learn a lot about how other patients cope with the disease, what they knew about the disease, how their caregivers felt about the disease. And I think that can motivate them to learn more about their gout and to get to their doctor and see if they need to be treated. Okay,
so that's Creaky, Creaky, Creaky Joints?
Right, all one word, exactly. Creaky Joints, all one word.
And .org.
Yep.
Okay, well, that is very helpful information. I'm sure it will be worthwhile to share with, in fact, helpful to share with my Health Power audience, and I'm glad we have a chance to talk today.
Great. Thank you for having me.
Okay. Have a good day.
You too.
All right.